reflecting on nursing practice using the Gibbs reflective cycle. NS38883, Nursing Practice 6, Assessment Task 5, Role Modelling for Professional Practice, presented by Kiki Elcote. Introduction. Applying the Gibbs reflective cycle. The Gibbs reflective cycle 1988, as cited in Ingham-Bromfield 2020, is a model that guides reflection through 6 stages: description, feelings, evaluation, analysis, conclusion, and action plan. By applying the Gibbs reflective cycle to a scenario that I've experienced in my nursing placements, I have been able to explore and analyse the scenario and learn from it in order to improve my own future practice as a registered nurse. Description. Summary of the situation. This stage of Gibbs' reflective cycle focuses on providing an objective account of the situation without any bias or judgment. By clearly describing the event, it allows for deeper reflection and analysis, which in turn helps us gain valuable insights and learn from the experience to enhance our future practice. Ingham-Bromfield, 2020. Feelings. Reflecting on emotions surrounding the situation. In the next stage of Gibbs' reflective cycle, we move on to feelings. This is where a person examines their emotional response to the situation. Reflecting on feelings helps to understand our emotional state and how it may have influenced the situation. When reflecting on this situation, I recall feeling uneasy and concerned as a nursing student observing such behaviour. The overconfidence and refusal to accept feedback were particularly troubling because patient safety was at risk. It also made me feel uncertain about how to approach or work with this nurse, knowing they could react negatively if I suggested something different. Their rude behaviour and hostility towards colleagues created tension in the workplace, making it an unwelcoming environment for teamwork and collaboration. I felt disheartened by the lack of accountability and the unwillingness to adapt to best practices, which contrasted with the positive learning environment I had hoped for. Ingham-Bromfield, 2020. Evaluation. Assessing the positives and negatives. The evaluation phase of Gibbs' reflective cycle involves assessing both the strengths and weaknesses of the situation to identify areas for improvement. Ingham-Bromfield, 2020. What didn't go well? The nurse's behaviour violated several professional standards. The ICN Code of Ethics, 2021. The nurse demonstrated a lack of accountability, failing to reflect on their practice or adopt evidence-based care, neglecting their ethical duty to continuously improve. NMBA Codes of Conduct, 2018. Their refusal to accept feedback, combined with hostile behaviour, undermined professionalism, respect, and collaboration, eroding trust and creating a toxic work environment. Registered Nurse Standards for Practice, 2016. The nurse breached these standards by ignoring feedback and relying on outdated practices, endangering patient safety. NSQHS Standards 2021 and Aged Care Quality Standards 2019. The nurse's resistance to adopting best practices compromised patient care, disrupting a culture of safety and collaboration. NMBA Decision-Making Framework 2020. By making decisions based on outdated beliefs rather than current evidence, the nurse violated this framework, increasing risks to patient safety. What did go well? The nurse's colleagues and senior staff upheld professional standards by offering feedback and supporting the nurse's professional growth. Their efforts aligned with the ICN Code of Ethics 2021 and NMBA Codes of Conduct 2018, fostering accountability, promoting continuous learning, and ensuring patient safety. Analysis. Understanding the whys. This step of Gibbs' reflective cycle involves a deeper analysis to understand why the situation occurred, linking it to nursing theories. The nurse's behaviour can be viewed through the lens of emotional intelligence and professional development. Ingham Bromfield, 2020. Emotional intelligence, particularly self-awareness and self-regulation, was lacking in this case. Key elements such as empathy, social skills, and self-regulation are essential for effective relationships in healthcare. Ingham Bromfield, 2020. The nurse's rude and resistant behaviour indicates a lack of emotional intelligence, affecting their ability to build positive relationships and maintain a healthy work environment. Overconfidence without self-reflection reflects poor self-awareness, while their moodiness and hostility show weak emotional regulation. In healthcare, emotional intelligence is critical for teamwork and decision-making. Bulmer-Smith et al., 2009. Ingham Bromfield, 2020. Improving emotional intelligence through training could help this nurse manage their emotions better, build stronger relationships, and foster a positive work attitude. Bulmer-Smith et al., 2009, Ingham Bromfield, 2020. Patricia Benner's stages of clinical competence also apply here. Benner's model explains that nurses progress from novice to expert as they gain experience. McEwen-Lake, 2010. This nurse seems stuck in the conscious incompetence phase, where they lack the necessary knowledge but refuse to acknowledge their gaps. Instead of learning from feedback, they resisted it, hindering their development. Recognising where they are in Benner's stages and being open to feedback from experienced nurses like the CN and NUM is crucial for their growth. McEwen-Lake, 2010. Conclusion: bringing the findings together. This stage of the Gibbs reflective cycle involves drawing conclusions about what could have been done differently to improve the outcome. Ingham Bromfield, 2020. From this analysis, it is clear that the nurse's behaviour consistently failed to meet the requirements outlined by industry codes and standards of practice. Had the nurse adhered to these frameworks, they would have been more open to feedback, reflective about their practice, and committed to continuous improvement and collaboration. This would have led to safer, more effective patient care and a healthier workplace environment. If the nurse had been more open to feedback and willing to reflect on their actions, it could have led to better professional development and improved patient care. Accepting accountability for mistakes would have prevented the continuation of incorrect and dangerous practices. Additionally, fostering a more positive attitude towards their work and colleagues could have created a healthier, more collaborative team environment. Other staff members could have provided more structured support or sought intervention from higher management to address the problematic behaviour earlier. Action Plan, planning for future practice. The final stage of Gibbs' reflective cycle is the action plan, where practical steps are identified to prevent similar issues in the future and improve outcomes. Ingham Bromfield, 2020. To ensure I'm promoting good role modelling and avoiding past issues, I will prioritise the adoption of professional standards. I'll adhere to the ICN Code of Ethics 2021 and NMBA Codes of Conduct 2018 in all aspects of my practice, focusing on professionalism, respect and collaboration. I will also seek continuous professional development, ensuring that I stay updated with the latest evidence-based practices and align my care with the Registered Nurse Standards of Practice 2016 and the NMBA Decision-Making Framework 2020, ensuring that safe and effective care is always provided. Additionally, I will foster a culture of feedback and reflection within my team, encouraging open communication and viewing feedback as an opportunity for growth, as outlined by the NMBA Codes of Conduct 2020. My practice will be guided by the NSQHS Standards 2021 and Aged Care Quality Standards 2019, making patient safety and quality care my top priorities, as well as addressing concerning behaviours early on, possibly with the support of senior staff. Navigating difficult workplace situations will require maintaining professionalism and seeking advice from trusted mentors when needed. I will also advocate for continuing education, particularly in emotional intelligence and self-awareness, as these are key to effective nursing practice. In conclusion, this reflection highlights the importance of adhering to professional standards and fostering a culture of a continuous improvement. By remaining open to feedback, pursuing professional growth, and adhering to evidence-based practices, I will not only perform at my best but also serve as a positive role model for both new nurses and my peers. Final reflection. My summary of the application of Gibbs' reflective cycle. In conclusion, using Gibbs' reflective cycle has allowed me to deeply analyse this situation and gain insights for my professional development. Through description and feelings, I examined the events and my emotional response. In evaluation, I identified both positive and negative aspects, while analysis helped me understand the root causes using theories like the Goleman theory of emotional intelligence and Benner's stages of clinical competence. Ingham Bromfield 2020, McEwen Lake 2010. The conclusion reinforced the importance of adhering to professional standards, accepting feedback, and fostering collaboration for safe and effective practice. In the action plan, I outlined steps for continuous professional growth and open communication to ensure patient safety and high-quality care. Overall, this reflection has highlighted the importance of self-reflection in growing as a competent, reflective practitioner.